I'm Dr. Sanjeev Haribhakti. I'm a GI surgeon practicing in Kaizen Hospital, Ahmedabad. And recently, about 15 months ago, I embarked on this robotic surgery by SSI Mantra, and I would like to share my experience with you. Over the past 15 months, we have done more than 170 cases with robotics. Recently, I would like to share with you that about 2 weeks ago, we did a case of total colectomy with 4 times docking of the robo. The first docking was for the rectum and the sigmoid colon. The second docking was the left colon and the splenic flexure. The third docking was for the hepatic flexure and the right colon. And the fourth docking was from the pelvis for the hand-sewn robotic anastomosis. So the entire procedure was done robotically, the total colectomy. So these are some of the very challenging multi-quadrant surgery cases that it's very satisfying that it can be done robotically with different mindset, with a different approach, and doing creatively more and more newer approaches. The real advantage of robotics, as you rightly mentioned, is precision and control. In robotics, the entire camera is under the control of the surgeon, so the surgeons can move the camera and take it where you want to see actually, number one. Number two, you are operating, going much more closer to the field and operating because the camera remains very steady. Number three, you get the articulation, the movements of the instruments inside, and that also gives a lot of precision to the surgery. Fourth, even the retraction of the fourth arm, we can use it. The surgeon can use it either on the left side or on the right side. He can decide where he or she wants to use it. So that also gives much better steady retraction so that the exposure to the surgical area is much better. And the other thing is that there are no tremors or there are no movements. Tremor filtration is there. So the movements are very, very precise, very steady, especially for very fine suturing at different angles. Robotic surgery has a big role, especially working in depths like rectum, at the hiatus, in the mediastinum. Robotics has a very big advantage. And doing more and more difficult cases, complicated cases like redos. We have done some acute cholecystitis, redo fundoplications. All these difficult cases, robotic helps us because it gives a very precise dissection and it can allow us a very precise surgery. That's a very good question because I searched for 5 years before I made the decision. 2019 से मैंने डिसाइड किया कि हमको रोबोटिक्स में जाना है, बट आई वॉज क्वाइट क्लियर कि एक स्मॉल हॉस्पिटल, सिंगल स्पेशलिटी हॉस्पिटल के लिए आई नीडेड समथिंग विच इज गुड, which can allow me to do all these advanced surgeries at the same time, which is a cost-effective platform. And so I looked at a lot of other options, not just once, but I tested them, I tried them 2 or 3 times. To my surprise, in a very short time of about 2 years, the system got so well refined. The second Mantra 2 was so much better than the Mantra 1. And then we thought that yes, now the system is good enough for us to do all these advanced cases which we would like to embark on. Before I bought it, it was very fascinating. After I bought it, initially it looked very challenging. Later, once we are more standardizing the procedures, we feel it's very satisfying. Okay, so at every step, you have different kind of feeling. I think I would say that Mantra system is a very cost-effective system, which is, it is possible to do most of the advanced surgeries. I don't want to compare it with other systems, but I can say that it can enable you to do what any other system can enable you to do. Today, there is no limit because the level of precision and the level of articulation that they have achieved is really good. The instrumentation, the vision, and the support of the staff during the surgeries is excellent. So that's a real benefit of the Mantra system. And of course, it's a homegrown system. It's a made in India system. We all feel proud that, a surgeon has created this kind of a system. So that's the real added benefit. कहते हैं ना सोने पर सुहागा, ऐसा हो जाता है.